Hey Facebook friends, just giving you a shout out here in my newly remodeled yoga space here at Flex Fitness and Yoga. Just gonna show kind of a new technique here that I've learned here to help eliminate tendinitis, plantar fasciitis, things like that, joint pain. This stuff is freaking amazing, and it can help definitely people that have repetitive motion issues such as runners, kickboxing, all sorts of different things that people love to do as far as fitness is concerned. But this lovely little tool here called the Edge. So if you've ever seen this before, this thing looks dangerous, looks like brass knuckles, but what it does, it helps relieve, get rid of adhesions and muscle tissue issues, similar to a deep tissue massage, but a little bit different or more active way of doing it. So for an instance, people that run a lot, or like myself, squatting, lunging, doing yoga even, we can create muscular imbalances in the legs or anywhere for that matter. But I'm going to demonstrate a little technique that I've been using quite a bit on my training clients and people that have been having some physical issues or pain that we've been able to basically eliminate fairly quickly. I used to have tendinitis real bad in my elbow and forearm. It took me about a year to really try and figure out how to get rid of that. And then I discovered this tool here over maybe 6 months ago. And I eliminated this and my pain in my elbow, tendinitis, epicondylitis, golfer's elbow or tennis elbow is also called, within 30 days of kind of using this technique. It took me about a year to even remotely have any release in it with other type of techniques. So this Edge, we're going to go today, I'm going to show you a little bit on the knee or the IT band. For all you marathon runners out there, Twin Cities Marathon just got over, or if you're going outside running more now in the nice cooler weather, this stuff is great as an active stretch or release to keep you on pace for your athletic or fitness goals. So without further ado, my lovely leg here. So people have a lot of issues here in their calf, their soleus, their attachment points into the knee, jumper's knee, Oscar slaughter, obviously up into the IT and the attachment of the hamstring and quad come down into the lateral or even the medial side of the knee. So what we use here, you can use any lubricant. I have, for an example, of this lovely coconut oil. It's easy to put on, healthy, safe, and you smell like a pina colada. So with that, all we're going to do is called scraping, or we're just basically assessing the muscle tissue with this tool that can help kind of figure out where those adhesions are or the muscle tissue that's dysfunctional. A lot of people have injuries on their lateral chain because they roll out on the ankle, or they sprain their ankle or have issues here. So we just find a simple basic stroking motion to find that tight spot. Once we do, we just kind of dig a little bit harder or change the angle of the tool. So you can hit different angles. The edges are pretty sweet, so they can change the intensity level. So right here, I have issues here in the attachment of my fibular bone out in here in the calf a lot over the years. And so just by scraping gently, it shouldn't cause a lot of bruising, but it will cause a little bit of redness, which releases histamine, which is an agent that can help basically release adhesions or rush oxygen and blood to the area. So here, we just scrape or strip this muscle tissue for, 5 to 10 minutes maybe, different angles, cross section, coming across that way or back through, right to left, left to right. And then I also can use kind of trigger point releases. So up here in the tendons, I have tendinitis here, an issue with the tendon. And we can hold that posture there. We can strip it through with the thumb. But also, we can make it a little bit more active from the client side or the patient side, from holding it up and then having them do the leg extension. And I hold the thumb exactly where that spot is, that tendon problem is. And they are basically stripping and stretching that tendon by active release. So it's pretty cool stuff. I found issues there. And then also up here into your IT band, kind of the small little band actually that runs from the knee all the way up into the hip. A lot of people think that IT is a big muscle, and it's actually really, really small. It's probably your tendon, your TFL, or your attachment down here into the quad and hamstring, or your adductors on the inner knee that causes you probably more issues than the IT itself. But you can scrape along the where the hamstring and glute kind of attach, or hamstring and quad attach. It's just a simple, basic tool that can help alleviate pain or release muscle adhesions. That can help with smoother movements through your squats, your lunges, or your running. It's amazingly different. It seems so basic and simple, it almost shouldn't work, but it does. It's crazy. So not very many people know how to do this very actively, or at least in this area. So part of my, expertise or specializing into not only strength training or yoga, but is how can we heal the body and keep it moving fresh and keep it moving through a range of motion that is functional without causing compensation. So it's an amazing opportunity to learn, even on your own. You can teach yourself how to do this and keep yourself healthy without having to quit your training, quit your running based off pain. Plantar fasciitis, a couple of people right now I'm working with, amazing results with plantar fasciitis in just a few weeks, working on the ankle and the calf. That is really the major issue when you have plantar fasciitis. And that tendon in the heel is causing that pain, but it's a problem up here in the calf and the tendon and the ankles. So this tool, the edge, can help strip that muscle tissue away or scrape it to help release pain, increase oxygen, blood flow, and water, and basically heal the body a lot quicker. So I thought I'd just share that with you here. It's a Friday, it's raining, it's quiet, and I was kind of working on my own issues. So I thought I would share that little tool, or that technique. So if anybody that's interested in learning more about that, or even have some issues, definitely reach out to me, watch the video again, or maybe post or like it and tell me what joint problems you have. And I'll keep posting videos or samples or demos on how to do the shoulder, for an example, or a biceps tendon, or even up here in your neck or shoulder area where you have migraines. So hopefully that helps you with tip of the day on Friday. Have a great weekend, and yoga classes and strength training, small group training here tomorrow and Sunday. So if anybody's interested, I'd love to see you guys. Thanks again. Assisted soft tissue mobilization, it's called. Assisted soft tissue mobilization. Have a great day. Thanks. Bye.